Hey, Dethroners, welcome back to the Dethroning Your Inner Critic podcast. I have with me today Dr. Mary O'Connor. So she is the Chief Medical Officer at Vori Healthcare. She is the co-author of Taking Care of You, the Empowered Woman's Guide to Better Health. She is the chair of Movement in Is Life, which is a nonprofit health equity coalition, and she's also professor emerita at the orthopedic surgery at the Mayo Clinic. And she is passionate about improving healthcare for women and particularly disadvantaged communities, as well as fixing our broken healthcare system. Wow, that is important. She is an advocate for diversity in medicine and the power of diverse perspectives to improve team performance. And on top of all of that, she is also a past Olympian in women's rowing. Oh my goodness. That is very, very impressive. Welcome to the show. I am so excited to have this conversation today.
Thank you, Joanna. I'm delighted to be with you and your audience.
Yes, yes. So before we start anything, let's just talk about you took my inner critic assessment. Your score was you have 50% restless inner critic, 100% perfectionist inner critic, and 25% inadequate inner critic. So let's just start with, how do you think that your inner critic has impacted your business? How has it impacted your life?
Oh, Joanna, those are great questions. And I think that my inner critic is both one of my greatest strengths and also a little bit of a detractor.
Yes.
So as for most things in life and with how we're wired, right? I'm a very goal-oriented driven person, and I get a lot of satisfaction out of, winning the race, accomplishing the task, and doing it well.
Yes.
Which is where, of course, the kind of perfectionist inner critic tendency comes in.
Yeah.
And I think that's okay. I don't have any issues with my drive to want to do things really well.
Yes.
Now, the challenge with that, of course, is you have to be able to appreciate the wins and get the joy out of that. And my new motto that I tell my team all the time is, team, we're following the 80-20 rule on this one.
Love that.
Which is, if we get 80% of it right the first time, we are rock stars. Okay. And we'll figure out the other 20% as we go along.
Yes.
And that's not just helpful for them in terms of like setting expectations that, hey, we're going to have some bumps along the way. It's not going to be perfect right out of the bat. Right. But it's also helpful for me to say, it's okay. It won't all be exactly right at the beginning. That's okay. It's progress. So I've I'll say adapted, right? Some skills to help me help me address some of the negative aspects of my inner critic.
Yes. Yep. You mentioned in the questionnaire that you filled out that you've progressed beyond seeking approval from other people. And that is, particularly with the perfectionist inner critic, that is huge, for all of us, particularly as women. So I'd love to kind of dive into that with you. How did you progress beyond that?
Janet, that's such a great point. And I remember the moment because I was like 40.
Mm,
isn't that craziness? That's just craziness.
I
And
know.
all of a
Yeah.
sudden I realized, like, you know what? I don't care what
Mm,
other people think of me.
right.
I know
Yeah.
what I value. I know what I think we should do.
Yes.
And this is how I'm going to lead the team.
Yep.
And it doesn't mean that when I say I don't care what other people think, that I'm not open to their feedback and that I don't, that, like, that is not what that means.
Sure.
What it means is that I am comfortable with who I am and what I think we need to do
Yes.
as a starting point, right?
Hmm.
And less really not looking for validation from others that I did a good job.
Yeah.
And
Yeah.
I'll share a specific example. So when I was a young orthopedic surgeon, and I would go to a national conference, and I would be up there on the podium presenting my research, I would walk off the stage and I would go to someone that I knew, and I would like routinely say, how did I do? How
Mm,
was it? You know?
yes.
And I
Yes.
realized, like, I am seeking the validation of others. I knew if I did a good job.
Right.
I absolutely knew if I
Yep.
knocked it out of the park or if I could have done a little better in one area or another, right?
Yep.
I didn't need someone else to tell me this, but
Right.
I sought it. And I realized, like, look, asking for people for feedback is different than saying, how did I do, as more of a personal validation. So it
Yes.
took me, I didn't even realize, of course, that I was doing this. Uh,
Right.
no,
Right.
you're right, I didn't.
Yep.
And I found it freeing. It was
Hmm.
liberating
Yep.
to be able to say, I trust myself.
Yes.
I know who I am. I know what I believe in. I
Yes.
know what I'm trying to achieve, how I'm
Yeah.
trying to help people.
Yeah.
And that's all I need.
Yep. Yep.
Yeah,
And I love what you said about, I was 40. Can you believe it?
can you
Because
believe it?
and particularly with somebody, with your expertise. I mean, you went from being an Olympian to becoming a chief medical officer. And so, I think so many women think that, you know, somebody of your stature, right? Somebody that has achieved what you've achieved, that you would not be somebody that would be seeking validation. And yet it's such a primal thing for women, right? I don't care who you are and where, right? What kind of credentials you have. It really impacts all of us. And I think it does kind of hit us like kind of like a frying pan in the face sometimes, like you were talking about, like that moment where you're like, why do I need other people to tell me that I am, that I'm valued? It's really
Yeah,
wild. Yeah.
I know.
Yeah.
Well,
Yeah.
I don't, one of the things that I suggest to young women medical students, physicians, I've mentored a lot of young people in my career and continue to do so,
Mhm.
is to really learn more about um, leadership skills and team dynamics and things that I wish I had known earlier in my career that are never taught in
Yes.
medicine to healthcare professionals.
Yes.
Because it really is all about the team, and I love teams.
Mhm.
And the better your team is functioning, the more enjoyable it is for the team members, and the better the results of the team, which in medicine means better care for patients.
Yes. Yeah. So what would you say are the most important key components for having having a team that
Mhm.
not only operates at an optimal level, but you know, what are the qualities that the leader of the team needs to embody?
So I learned a lot from a gentleman named Harvey Robbins, who's retired now, but he
Mhm.
had been at the Carlson School of Management in Minneapolis. and fascinating guy, background in the CIA where he trained covert teams. Now, talk about teams having to perform well, right?
Yeah.
And basically, there, I learned that there's kind of four groups of people in terms of their personality styles and how they communicate, and a lot of different psychologists have used this framework, but I like his framework because it's pretty simple and I can remember it and even try to operationalize it in my life. So there's the drivers, right? And I'm very much a strong driver. Get the work done. Here's the goal. There's the expressives, because I'm also an expressive, big picture people, right? So
Yep.
they're thinking of, the vision, but if you're really a strong visionary, you don't want to get the work done. You just want to have the fun of thinking of the big idea. The
Yes.
analyticals that are totally data driven. I mean, it's all about the data, which is why when you see an executive report, you have the executive summary. Who's that for? The drivers. And the appendices, who's that for? The analytics, because the analytics want to dive down into the data. And the drivers are like, just give me the bullet points, give me the summary.
Right.
And then the fourth group are the amiables, which are the kind of people, the connectors. And all these four types are critical to high performance teams. And most of us are a blend of two types, sometimes three. The analytics tend to be very dominant on the data-driven side. But when you're a leader, flexing your communication style to try and meet that of the other person is critical. And I just had this example yesterday where there was a little conflict on my team because one person sends out a note and says, I need you to give me this information. And she includes this table. And her expectation is that somebody's going to put the information in the table. But she didn't explicitly say that. And so one person that responds simply writes back, done. And she's frustrated now, right?
Yeah.
And I wrote back, I said, you actually didn't communicate this well enough. Okay.
Yep.
Like you had to be very specific. This person needs that level of specificity. So it's, and so now instead of her thinking the other individual that just wrote back done is just ignoring her or dissing her in some way or not being cooperative.
Yes.
Now we gain some psychological space for her to think differently about what happened in that email interaction.
Yes.
And so little things like that all impact how teams perform and how we think of each other. And we want to like the people that we work with. I mean, we don't have to love them, right? But we want to respect them, and we want to feel that we're all aligned and committed to the same goal.
Yes. I love what you're saying, because I often talk about that we all have these, I call them they're core wounds, right? There are these triggers that trigger us, and they show up everywhere in our life. So, the example you were talking about, this woman feeling frustrated, like, again, I'm guessing here, but it sounds like there could be some automatic interpretation, like, you're not listening to me, you're not hearing me, you're not right, you're not taking into consideration what's important to me, and right, and meanwhile, it's just a miscommunication, and it is so important, whether you're talking about a team or you're talking about any relationship, that we understand our own triggers and that we take responsibility for them. And so many people don't even know what's kind of lurking below the surface of their mind. And they're just automatically reacting all over the place.
Because she didn't communicate in the style to which the other person would be most receptive. So effective leaders have to flex their communication style to try and align as best they can with the person they're trying to communicate with.
Yes.
Okay. That's the key,
Yep.
right? It should be the leader's responsibility to do this.
Yes.
And, leader is a very broad term. Leader is a parent.
Right.
Leader's not just someone at work, right?
Right.
Yeah.
Yep. I mean, leader can just be, a woman advocating for herself in her career, or right, or in
Correct.
anywhere in her life. Yeah. And so how did you learn about your own communication style and taking ownership of your how you perceive other people?
So, I've had some wonderful executive coaches in my career,
Hmm.
and that's another thing I encourage all uh, young orthopedic surgeons that I mentor to do. And
Yes.
I'm like, look, even if you can't afford somebody a lot, like, go find yourself a coach.
Yes.
It's been so incredibly helpful to me in
Yes.
my career. And I'm still on a journey of learning and improving, as we all are.
All of us.
Um, and so working with somebody like that, I think is really important. And I'll share one short story, right? So um, one of my coaches, who is probably one of my best coaches, when I first started working with her, I was like, "Oh, I'm not sure this is going to work." She kept asking me, "Well, how do you feel, Mary? How do you feel?" And I was in total, like, I'm like, "What? I don't care how I feel. I just want to accomplish the task, right? I want to win I want to achieve this. I
Hmm.
need you to help me be more effective at reaching the goal."
Yeah.
And it took me a little while to realize that she was totally right. It
Sure.
is all about how people feel. And it's an illusion to think that we use data and rational thought to make decisions. I know we
Yes.
want to believe that, but it's just not true.
Right.
Okay. We use data and rational thought to help support the emotional decision that we want to make.
Mhm. Yes.
Yeah.
Yep. It is all about how we do everything in our life because of how we think it's going to make us feel.
I
So,
know.
yeah.
Like, let's recognize that. Let's embrace that. Right.
Yes.
And, really, she really helped me
Mm.
recognize that I needed to flex my style
Mhm.
and be more connecting and amiable with the people that I worked with,
Yeah.
instead of such a strong driver, like, boom, let's go do it.
Yes.
And yeah,
Mm.
was good.
Yeah. So, it strikes me because you are someone that, listen, people really would kind of consider you a rock star, right? You went from being an Olympian to becoming chief medical officer, right? You wrote a book. I mean, you've really done a lot, right? And so here you are talking about, like, no, I don't want to talk about my feelings. I just want to get the job done. Right. So if we kind of talk about that journey from being an Olympian to being chief medical officer, um, you know, what were some of the hardest parts of that journey? And specifically, this is what I find a lot, Mary, particularly with, women that are so driven and so accomplished, is that they kind of keep hitting the milestones and hitting the targets and hitting the goals. And they're kind of quickly on to the next and on to the next and on to the next. And many of them get to a point where they've checked a lot of boxes in their life, right? They are super accomplished, super successful. And, talk about feelings. They're sort of continuing to feel unfulfilled, dissatisfied. Um, and I'm wondering if that's anything that you can relate to and how you've dealt with that, or maybe even how you've um, overcome that.
So I think for me, what was really critical was, um, I'll say, living in my passion zone, right?
Mm. Yeah.
And getting to the space where the work that I'm doing is
Mhm.
really, really focused on the things that matter to me.
Wow.
And
Yes.
when, and I am in that space more now than I've ever been in my entire career. And it
Amazing.
is a great space to be in
Yes.
because it fuels me. I mean, it gives me the energy to get up and continue to fight to make the changes that we need to do the work, which,
Yes.
I mean, I'm chief medical officer and co-founder of a company, Vori Health, where we're working to transform the delivery of musculoskeletal care, meaning orthopedic and spine care. And, I could go on for a long time about how broken the healthcare system is, right? So,
Sure.
and I've had the privilege of caring for, thousands and thousands of patients and families over my career. And I
Mm,
loved taking care of patients,
yes.
but I can impact so many more people through this work.
Yep.
And I can work to be a positive change in how we make healthcare better
Amazing.
because it just doesn't work for so many people. And we can't ignore it. Like somebody has to step into this and say, okay, we're going to work to make this better. We're going to try this solution. We're going to
Mhm.
refine it. The parts that don't work, we're going to fix.
Mhm.
So like, boom, baby, I'm there. That's my space.
Right. Right. So you get lit up because of the
I can feel it. I can feel the
difference.
energy.
Yeah, absolutely. Right. You're making that difference in the lives of others, and it just becomes like about, as you said, living your passion and living your purpose. It's sort of um it's not about you, right? It's
It's not
about the
about me.
yeah. Yeah. That's awesome.
And I've had a great career, Joanna. I mean, I could retire, right? I could say, okay, I'm tired of working. And it would be nice if I worked a little less hard at this stage of I mean, I'm working as hard now as I've ever worked,
Mm.
but
Mhm.
I am, I'm just I'm just working on the things that really matter to me.
Fabulous.
Yeah.
Yeah. That's a
And
gift.
it's wonderful.
Yeah. Yeah. Let's talk about your book. The book
Oh,
is called Taking Care of You, The Empowered Woman's Guide to Better Health. So, can we talk about uh, the takeaways from that book that are crucial for women in prioritizing their
oh.
physical health, their emotional health?
So, Joanna, I've been very passionate about health equity. As you mentioned, I lead a national nonprofit called Movement is Life. Um,
Hmm.
we will have our annual summit this year in Atlanta, Georgia on November 14th and 15th. People can go to the website. You can put it in the notes. Um, so I have, I've just seen so many women
Mm,
have less than great healthcare,
yeah.
and particularly in orthopedics, where I have always been a minority in my profession. Okay.
Hmm.
I mean, there
Yep.
are not very many women orthopedic surgeons, and particularly when I was a younger surgeon, there were even fewer.
Yep.
So which it would just be that these women would come to see me and they had seen other orthopedic surgeons, and I'm like, well, what happened? And the summary is their voices were not heard. And
Mm,
I'm not saying this to crucify my fellow male orthopedic surgeons. I do not think that their intent was to not give good patient care. I'm
right.
saying that there is sometimes this communication divide. There's unconscious bias that comes into the patient encounter, either from the physician or surgeon side or the patient side. And these are barriers to people getting great health care.
Yes.
So so I could, uh, you know, impact one woman as a patient, or I could try to help many women by co-authoring the book with my fabulous co-author, Conwell Hawk, who's a medical anthropologist.
Mhm.
So the book is really a user guide written in very plain English to help women understand health issues,
Mhm.
55 common clinical conditions that we often don't think of as impacting women differently than men.
Hmm.
So there are a lot of true, I'll try to not get too technical here, but
Mhm.
this is important stuff.
Yeah.
Women are not little men,
Mm.
all right? And females are not small males.
Mm.
So we have sex differences. We
Mhm.
are females are biologically different than males.
Yeah.
Gender is how we identify in terms of a man or a woman.
Mhm.
Both are important, but people can't forget that sex, meaning true physiologic, biological differences exist
Yes.
and must be recognized. Okay.
Mhm.
I'll
Yeah.
give you an example. Heart disease.
Mhm.
Classic symptoms of a heart attack is, oh my God, I have crushing chest pain, the elephant's on my chest.
Mhm.
That happens when the big blood vessels in the heart get blocked.
Mhm.
Women who can still have classic symptoms, the elephant on my chest, are more commonly than men get small blood vessel disease in the heart. So the disease, the way heart disease occurs in females is
Mhm.
different a lot of times than in males.
Mhm.
And if a woman doesn't know that, or the doctor in the emergency department doesn't think of that, then
Yeah.
guess what? She gets sent home telling that she has an upset stomach when she's really having a heart attack.
Oh my gosh. Yeah.
So these differences matter. So we take these 55 common clinical conditions that are, we call them non-bikini conditions, because there's a lot of, quote, women's health that focuses on breast and reproductive health. But we
Uh-huh.
are more than boobs and tubes, right? We are whole people.
Yeah.
And
Yeah.
and there's so many medical conditions that affect us differently. So the book is, again, very written for the average person. You don't have to be a medical professional to read this. It talks
Yeah.
about, okay, what's the condition? What causes it? How is it treated? How does it impact women differently than men?
Yep.
And if we had data on race, ethnicity differences, the authors would pull that in too.
Mhm.
Questions to ask your healthcare team and pearls of wisdom from the author. So we had 111 women contributors to the book, all
Mhm.
experts in their field.
Mhm.
So yes, I'm very proud of the book. It's really was a labor of love to help women be better advocates for their own health needs.
Absolutely. Yeah. And I would think that there are, um, there's some unconscious conditioning amongst women that might also play a role, right? We tend to, you know, focus on everybody else, right? We tend to be, have a million different things going on in our lives. And so it's almost like, I mean, I find that so many women, between managing their career and managing their families and everything in between, um, they kind of lose themselves in the process. So, what would you say are like the, top most effective ways that women can be advocates for their own healthcare?
So I think the first thing is to find healthcare professionals that listen to you. Like
Mhm.
I know that sounds simple or kind of crazy, but it's really, really not,
Yeah.
right? If
Yep.
like I can't
Yep.
tell you like how many women I've seen that would come to see me, they had surgery by another orthopedic surgeon, they were unhappy, they were having a problem.
Yep.
And I would say, well, what did you say to the other orthopedic surgeon? Did you see this person to discuss the issues? Yes, but he didn't listen to me.
Yes.
And I would be like, well, and I would want to say, and
Yes.
sometimes I did in a more gentle way, then like,
Yep.
why did you let this person cut on you? Like if they didn't listen to you
Oh,
before the surgery, Why
Right.
would you think they're going to listen to you after the surgery? And the response was, well, he has, and I'm using he because it was, mostly he has such a great reputation, great technical reputation. I'm like, oh my God. Like,
Mm.
like you need somebody who listens to you.
Yeah.
And again, because if they don't listen to you before you have surgery, don't think they're going to listen to you afterwards. So
Right.
it's not
Right.
just about surgery, right? It's about taking your symptoms and your concerns seriously,
Yes.
because society has conditioned
Hmm.
all of us to
Yep.
say that women are making shit up. Excuse me.
So true.
We're
No, you're,
making stuff up. We're
mhm.
exaggerating. When we
Yep.
say our pain is 9 out of 10, it's not really 9 out of 10. But when the man says his pain is 9 out of 10, he's in excruciating pain. So
Oh,
society has
yeah.
conditioned us
Yep.
to say women are making it up, we're
Mhm.
exaggerating, and that is to our detriment.
Yes.
That puts us at
Yeah.
risk.
I just spoke with a woman 2 days ago. She's petite woman, fit woman. She's in her mid 50s and, you know, constantly was complaining about shortness of breath. She had trouble, even walking just a few short blocks. And she went to doctor after doctor after doctor, and they kept diagnosing her with long COVID. And she said, that doesn't make sense. There's something going on. I mean, this was going on, she said, for like 2 years. Finally, she heard about on her own getting a calcium score for her heart, came back as 400. She said she was in the 99th percentile for having a massive heart attack. She was small and petite and active, so they discounted, that she was at risk. And no doctor said, I think we should, get your heart checked. She had to hear about it on her own and request to get that kind of test. And I think most women, just kind of take it at face value. Well, the doctor is, telling me this, so I'm just going to accept it. We're kind of used to,
So
listening to the medical professionals. Yeah.
I'll share. There was a fascinating study just a couple years ago that looked at a huge number of patients at a major academic institution in Boston. There were adults who were admitted for the common things that adults get admitted to the hospital for, like pneumonia, heart attack, things like that. And
Yeah.
they looked at survival. In other words, patients who lived to make it out of the hospital.
Mhm.
And if your admitting physician, if the physician leading your medical team when you were in the hospital was a woman, your chances of survival were statistically better than if the physician leading your care team was a man. Now,
Just saw this on the news. There was just I'm telling you, I think it was just this morning something on the Today Show about this. It's fascinating you're bringing this up.
right.
Yeah.
And so when the researchers, of course, they don't know why this is. Here's the finding, here's the data. It's good data, huge number of patients, statistically significant. So, science would tell us this is likely for real, a real finding. Okay.
Yes.
So
Mhm.
when the authors then kind of postulated, okay, so why do we think this could be? Because we don't know why it is. One of the thoughts was, well, the women physicians are less anchored to an existing diagnosis. They're more willing to consider other options earlier than
Mm.
the male physicians.
Yeah.
And that can help a patient who's not improving, right, get better. Like we're like, okay, patient isn't doing so well. Are we missing something? And that the women physicians would get to that point of asking the question, am I missing something as the patient's doctor
Hmm.
earlier than the men?
Amazing.
Yeah.
This is really, really important that more people start talking about this. Um, and so given that you are somebody that is working harder than ever before right now, how do you take care of your not just your physical health, but your emotional well-being? What are the most important things that you do to stay balanced and grounded?
That's a great question, Joanna, and I will be the first to admit that I can do better.
Mhm.
It's always a journey, but I do exercise regularly.
Mhm.
That's important to me, and it really, really helps me with my stress.
Yes.
And I'm very blessed with a wonderful family,
Mhm.
which is a great source of, joy for me.
Yeah.
And I really try to practice, gratitude, and
Mm.
I'm a very spiritual person. So I'm grateful to, Divine Mother for all my blessings that I have.
Yes, yes.
Yeah.
I would say those two things you just mentioned, gratitude and some sort of spiritual connection, it's really crucial to, you know, to cultivate that in one's life. Um, what are the things in your life right now that you would say are causing you the most stress? That's a loaded
Yeah,
question.
it is. I'll tell you. I am also the chief compliance officer at Vori Health, and we're in the middle of our high trust audit. And for anybody that knows what high trust is, you can understand why that would be creating some stress as we're going through editing some policies and procedures, and clean up stuff. And so you know it's just part of the deal. But
Yep.
yes, I mean, I try to, uh, of course, like, recognize that my adult children are adult children now and support them, but I can't, you know, I can't make them be healthier. I wish that, they would embrace some improved lifestyles, a few of them, but they're good, they're good kids, and they have good hearts, and they have good values. And, like, we've avoided many of the parental disaster things. No one's ever been arrested. We
Mm,
we've avoided big problems.
yes.
So I'm very grateful for that. But I have to recognize, like, they grow up, they have their lives. I'm here to, unconditionally love them, my husband and I, and support them as best we can,
Mm,
but you can't stop being a parent and saying, "Oh, can't
yes.
I really think you should do this."
Yeah.
No, it's not about you. They're going to do what they're going to do.
Right. Right.
Yeah.
So, bringing the ideas of gratitude and spirituality to that, and you mentioned with your kids or with, what's going on professionally in you said it's an audit, correct? You said?
An audit,
Yeah.
yes.
Yeah. So, I mean, it sounds like even to tie both of those things together, it's like you kind of have to do what you can do in the moment while at the same time letting go and letting God and sort of recognizing that, we can do we can do what we can do for our children. We can do what we can do professionally, but if we've got too tight of a grip on our expectations or our wishes or our hopes or, kind of that life is going to go in that direction, um, particularly with things that we can't control, it's it it causes a lot of stress. Not just emotionally, but I would imagine physically as well.
Yeah. So, one of my sayings that I will commonly share with my one of my children, um, which is good for me to say to her, because when I say it, I hear it too, right?
Mm,
Which
yeah.
is, you are safe in the fortress of God's all protective love,
Mm,
right? We are all safe in the fortress of God's all protective love.
yes.
And it just helps me, because I know that that's true, and I know that all of my strength, my strength, my passion, I'm
Mm,
grateful, because that all comes from, I like, Divine Mother. We can
yeah.
be
Yep.
expansive in our concept of the divine,
Of course.
and that gives me, I think, my inner drive and passion to to do good work that will
Mm,
help others, and
yes.
hope, and then I'll admit, here's where my ego comes in. I want to help others in a bigger way, right?
Hmm.
That is
Yeah,
actually a very ego-driven statement, right?
sure.
Mary O'Connor, want to accomplish something bigger.
Yeah,
Okay.
yep, yeah.
But I accept that, you know.
Yeah, and there's such a balance, right? I mean, because I can relate to exactly what you're saying because I have a lot of big goals and dreams for, the way that I want to impact women and help them to change the way that they think. But for me, and I would imagine that this is similar for you, I can keep taking steps in that direction, but I also have to let go and let, again, divine mother, the universe, God, whatever you're going to, right, to let the powers that be take my work, take your work wherever it's meant to be. And going back to that perfectionist inner critic, I have a restless perfectionist and inadequate inner critic, so I'm constantly having to battle, kind of unhooking myself from, right, I want, right, I want my work to get there and I want to make a bigger impact. And no, I can just take the steps in the moment and it's going to go where it goes. Is that something that you practice internally for yourself as well?
Yes, I work to be in the moment,
Yeah.
right?
Yep.
Um, when I'm in the moment and I'm focused on that, then I have less stress because I'm not creating this kind of web of anxiety, like I should be doing this or that. And
Mm.
actually, though, in a funny way, I learned that this trick from my older sister years ago, because she would say, all right, Mary, make a list of all the things that you have to do
Yeah.
and then prioritize them. And now take the first thing on the list, work on it, and forget about all the others. That's the key. You forget about all the others.
Yes. Yeah.
Okay. Now I'm not mentally handicapping myself by worrying about the other project, and I can focus on the first one. And you know what? When I get the first one done, number two becomes number one. And I
Mm.
have used that with, I can always do better, but that has helped me a lot because it helps my helps my mind not get, oh my God, look at all the things I have to do and they're all due and how am I going to get them all done? And this creates all this anxiety and like that's just counterproductive.
Yeah, completely. Yep. Mary, what's the legacy that you want to leave behind?
Oh, well, that's a great question, isn't it? I I would like I would I would like to be remembered as a good person who was a good wife and a wonderful mother, um, a great doctor who helped her patients,
Mhm.
not just individually, but helped patients in a much broader sense with improving the way that we deliver care in this country
Mhm.
and helping to make healthcare better for all and addressing some of the really horrible and disturbing disparities that we have that particularly impact women,
Yes.
individuals of color, and those in rural America, because we keep forgetting about people in rural America. So
Yeah. Mm.
lots and lots of opportunity to try and make things better.
Yeah. Wow. Mary, I really do love the work that you do. I appreciate the work that you're doing for women. It is incredibly important, all the work that you're doing. Where can people find out more about you? Where can they purchase your book?
Well, they can purchase the book on Amazon. They could purchase it at Barnes and Noble, Target. So you can just Google it and you can purchase it. Mayo Clinic Press. Mayo Clinic was our publisher. Um, where else? I mean, you can find out about me on our Movement is Life website. You can find out about me on probably our Vori Health website, which is the medical company, virtual medical company that I've co-founded. And certainly anybody that's interested in that has some need for care for their, back or knees or shoulders, we are really transforming the delivery of care. So I'll give a little pitch for what we do. We surround people with a care team, a physician, a physical therapist, a health coach, a registered dietitian if you need more nutritional support. Our doctors are musculoskeletal experts who are non-surgeons. And even though the company is founded by two surgeons, me, an orthopedic surgeon, and my co-founder and CEO, Ryan Grant, who's a spine neurosurgeon, we focus on, can we get you better without surgery? Because we know, and we're two surgeons talking here, right? That a lot of surgery is actually, unfortunately, inappropriate and could be avoided if patients received better non-surgical care. And there's lots and lots of reasons for why the system's so broken, but like, we just have an amazing team of clinicians and just love helping patients. And, we're enjoying transforming MSK care.
Fabulous. Fabulous. Yeah. Thank you for today, for being on the show. What a powerful and important conversation today.
Thank you, Joanna. Blessings to you and all your listeners.
Thank you. Thank you. All right, everyone. Thanks for listening today.